If you want to know what to do when you have a loved one critically ill in intensive care after a car accident with a traumatic brain injury and brain bleed, stay tuned. I've got news for you today. So I've got an email here from Serbu who says, "Hi, Patrick. My father had a car accident, and after the impact, he had brain surgery as the right side of the bone was broken and a small part was touching his brain. Blood also came out. Now, after the operation, he has been in an induced coma for 5 days. What can be done?" Thank you so much, Serbu, for writing in. And I've worked in critical care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And we have saved many lives with our consulting and advocacy. And you can verify that on our testimonial section at intensivecarehotline.com or on our podcast section at intensivecarehotline.com, where we've done client interviews. Back to Serbu's question. So here's what happens when patients in intensive care have a traumatic brain injury, whether that'll be from a car accident or people falling off ladders and roofs and everything else that I've seen over the years. When there's a bleed on the brain or a traumatic brain injury, there's a lot of pressure on the brain. And there's only so much pressure the brain can take before a patient can die, or it is getting extremely life-threatening, or it is causing irreversible brain damage. So let me explain. When there's brain pressure, often there's a catheter inserted into the brain to measure ICP, intracranial pressure, also known as the brain pressure. That should be less than 20 millimeter per mercury. Otherwise, there's the risk of sustaining irreversible brain damage. Also, CPP needs to be measured, cranial perfusion pressure, i.e. the pressure, the perfusion that is going to the pressure of oxygenated blood to maintain oxygenated blood to the brain so that the brain isn't getting irreversibly damaged. That needs to be above 60 millimeter per mercury. So that means the blood pressure needs to be ideally above 85 or 90 systolic minus the ICP, so that the CPP remains above 60 millimeter per mercury. That can be difficult to achieve at times, depending on what is going on in the brain. So several strategies that can be used here to manage the intracranial brain pressure. One would be to put an EVD in, an extraventricular drain, and drain fluids from the brain, either drain CSF or blood from the brain to minimize the pressures. Another strategy is to use diuretics such as mannitol to diurese extra fluids on the brain. Other strategies are hypertonic saline, that can also be used. But another strategy is also surgery by doing a craniectomy, removing parts of the skull to let the brain expand and deal with the extra pressure. So those are some strategies. Other strategies are to deeply sedate a patient, to put them in a deep induced coma, sometimes even paralyze them, to not do anything else, let anything else interfere with the brain. So what can happen there is, you can put people into an induced coma, often with midazolam / Versed or fentanyl or morphine, also in some cases phenobarbital, to really put them in a deep coma and let them rest and heal. Now, that comes with undesired side effects. If you put patients in an induced coma, they're at higher risk of sustaining DVT, deep vein thrombosis, a stroke. All sorts of things could go wrong in an induced coma, whilst patients are also mechanically ventilated. You also often can't give anticoagulation, because again, there's a risk for bleeding. So there's several things that need to be very, very closely monitored. But the reality is that when someone has a traumatic brain injury, putting them in an induced coma and let them rest and heal is a good strategy. The problem is, the longer this goes on, there is deconditioning happening, i.e. when a patient comes out of the induced coma, often they are confused, agitated, not waking up straight away, and they're deconditioned because they've been lying in bed sometimes for days, weeks. So they need to start rehabilitation, and that can start with just some physical therapy in the bed. It can continue with just sitting patients on the edge of the bed for a few minutes. So there can be a very long road to recovery, but there definitely can be a road to recovery. Also, when patients are ventilated for more than 2 weeks, generally speaking, in a situation like that, they also often need a tracheostomy, right? So that they can be woken up and then slowly but surely rehabilitate, right? Now, in a situation like that, once again, having dealt with ICUs all around the world, there can also be very negative ICU teams in some situations, but that shouldn't stop you from fighting for your loved one, and that shouldn't stop you from advocating for your loved one. And that is what we are certainly doing here. Like I said, we have saved many lives in situations like that with our advocacy, with our intensive care insights, and with being the experts on patient and family rights. What is also very important in a situation like that is that you as a family get support, and that you feel supported, and that again is what we are here for. We are more or less hand-holding families in intensive care through this once in a lifetime experience that you really can't afford to be getting wrong. So Sirbu, I hope that answers your question and helps you to manage this difficult situation, because we're getting so many questions for families in intensive care. And this is a question that came through last year in October. We are now, at the time of this recording, it's June 24. So we're getting so many questions from families, and if you want me to do your video or your question quicker, maybe a little donation here at YouTube, and donate a little bit to our cause so that we can make as many videos as possible. Click the little dollar button and there, and that will speed up me making a video. And it'll help us to help our cause and answer as many questions for families in intensive care as possible, so that we can help as many people as possible. Do a super chat below and I'll get to your video as quickly as possible. Now, because we get so many questions from families in intensive care, that's also why we created a membership for families of critically ill patients in intensive care at intensivecarehotline.com. And you can become a member if you go to intensivecarehotline.com by clicking on the membership link, or by going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally recorded and written with all my 2.5 decades of intensive care nursing experience. And that insight will help you to make informed decisions, having peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And once again, I handhold you through this once-in-a-lifetime experience that you can't afford to get wrong. If you think you can do this by yourself, you are unfortunately mistaken. Many families come to us when it's too late, when they have lost a loved one, and then they realize, oh, if I only had gotten help, And if you think I want to scam you out of some money, you can think that, but that's not what we do here. Yes, we do charge for our services, but it's worth every dollar. And once again, I encourage you to look up our testimonial section and our podcast section, where we've done client interviews to verify what I'm saying. I also talk to doctors and nurses directly if you want me to do that. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care, once again, so that you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. I also represent you in family meetings with intensive care teams, and we also do medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care. If you have unanswered questions, if you need closure, or if you are suspecting medical negligence, and all of that you get at intensivecarehotline.com. call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. If you want to make a small donation at the super chat button, and you want to have your video done as quickly as possible, make a small donation, and then I will get to your video as quickly as possible. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Also share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on the show. And you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you're a subscriber to our email newsletter at intensivecarehotline.com. Thank you for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.